Fairsy's Big Breakfast, thanks to Harvey Norman Launceston.
I'm in love with your body.
You might remember Health Minister Michael Ferguson had a health forum in Launceston at the Grand Chancellor the other night. So it was an opportunity for people to go along, the public, and ask questions about the health system and things like that. Now, one lady who was in the audience is Lynn Cleaver from Medicinal Cannabis Awareness Tasmania, who joins me now. Lynn, good morning to you. How are you going? Oh, sorry, Lynn. There you are. I'll press you. How are you?
Good, thank you. How are you?
Look, very good indeed. Now, there were mixed views coming out of the meeting. I had some callers the other day saying it was good and positive, but unfortunately, it doesn't seem to be moving as straightforward as what we'd like with the medicinal cannabis front, is it?
No. Well, I went along specifically to ask questions about medicinal cannabis, and unfortunately, the news wasn't that good. The good news is that the controlled access scheme will come out, and there's 3 target groups that will have legal access.
Yes.
The bad news is that even some of those people will be refused once their doctor thinks that cannabis would be a good thing for them to prescribe their patients and for their patient to use. Potentially when they go to the panel to be approved, they will be knocked back, which it seems a bit odd to me that if a doctor thinks that cannabis should be used, then no panel should say that it shouldn't.
Yeah, exactly.
And the other bad news is, of course, that the rest of us are still going to be breaking the law.
Yeah, so you know, obviously you're pushing for protection on that front. But the 3 target groups, paediatric, epilepsy, cancer, and I think the other one is chronic pain. Is that right?
Yeah, that's right.
Yeah. Okay.
Yeah, which is really good. I think hopefully that they'll put the framework in place so that people can actually get to see their doctors in order to get the ball rolling. I think, like Minister Ferguson indicated that most of the money in the budget would be going to support the paediatric epilepsy rollout.
Yes.
So I'm not sure what will happen with the other target groups.
So under this scheme, are you covered with your son Jeremy? Because just quickly tell us about Jeremy again and what he suffers from.
Yep. So we use homegrown cannabis for Jeremy. He's been using that for 3 years now, and been able to replace most of the anticonvulsant medicines which were ineffective and were toxic to him with cannabis. Under this scheme, we won't be able to get legal cannabis for him because he's not he's not a paed. So basically, Mr. Ferguson pretty much said to us, well, you need to reconsider your use of cannabis, which I found incredibly offensive, considering that cannabis is the only thing that works for him. There's nothing else left to use.
Yeah, absolutely.
So,
no, spot on. And with the cannabis, since you've been using that, what were Jeremy's seizures before and now?
Yep, so his seizure counts, it's reduced. He has a lot less of these partial seizures. He's healthier, he recovers more quickly from the seizures he does have. And, of course, he's not taking all of those drugs that were, causing the issues with his bone health and his gums and his skin and his hair. And, the list is really, really long of side effects from those drugs that weren't effective. So, and Jeremy's not alone, There's 20,000 people living in Tasmania with epilepsy, and 30 to 40% of those will not find adequate control with conventional medicine. So I think a lot of those people will probably at some stage find themselves at cannabis. Sorry,
you there, Lynn?
Yep, I'm here.
Yeah, sorry, you dropped out there.
Sorry. Yeah, so it seems to me that Mr. Ferguson is just not listening to the people, and I wonder if, his personal opinion, which isn't science-based around cannabis, makes him the best person to develop and enforce policy on it,
Yeah, because have you actually sat down with him? I mean, if I was a minister, like health minister, whatever minister, I would make sure that if I was going to implement a scheme, I'd be meeting with the groups that it's going to affect and finding out all about it. Has this happened with you and the minister?
No, and he's I spoke briefly with him privately the other night as well, and he said, look, we're going as far as we can. And I said, Michael, that's not far enough. These people will continue to use illicit cannabis if you don't put in a framework that protects them. So, and if a framework were to be put in place, the medicines we use could be tested and we could be followed by our doctors and everything that he wants. But he's hindering because he won't move to protect and put in place a framework that allows all of those things to happen.
Yeah. I mean, look, I understand. I had the minister on, and I mean, I understand like he's got to be careful on what he does and implements and that. But when the scientific evidence proves without doubt, that it works, that it is working. I mean, other states are leading the way, and we had an opportunity to do that, and we've fallen way behind, and we still haven't got a date for the release of the scheme.
No, well, apparently it's supposed to happen on the 1st of September, but, talking about, the science, you've got doctors like David Caldecott out of Canberra, I think it is. He's hosting courses right across the country at the moment, educating doctors and politicians too about the benefits and the science around medicinal cannabis. So I'm hoping we can get him to come to Tasmania, and perhaps Mr Ferguson would like to go along and learn about the science. But, Rob, I think... For people with the election coming up, I'd really like to say that if you believe that the Liberal government's policy around medicinal cannabis doesn't suit you, vote with your feet. I know Labor has a better policy, and I'm sure the Greens will too.
All right. Well, Lynn Cleaver, thank you so much for your time. You're doing an incredible job with your son, and let's hope you do get some protection, and I can guarantee you I'm not going to give up the fight to push for it either. So
thank you
there
very
you
much,
are.
Rob.
So no worries at all. That's Lynn Cleaver from Medicinal Cannabis Awareness Tasmania.
Fairsy's Big Breakfast, weekday mornings from 6 on LAFM.